my friends, this is Dr. Diana and I am pretty ill. When I started this site, I promised that I would tell you everything, right? Well, be careful what you wish for, because today I will share with you my progression of symptoms. Oh boy. I do this for two reasons. One, watching these videos can be deceiving if you are suffering. Although most of us understand the "but you don't look sick" thing, it can be easy to forget that I can pick and choose when I make a video. And trust me, no one would watch this site if they saw me with my little bed desk and no makeup on. Trust me. Currently, I am reclined about 40% of my day and have bursts of either sleeping most of the day or bursts of adrenaline when I can't sleep most of the night. Very strange. So these videos are carefully orchestrated so as not to frighten anyone away. Secondly, I am sharing my symptoms because I know a lot of you can relate to these, but are afraid to say anything for fear of being called a whack and sent out the door of your doctor's office. Trust me, I have been called much worse. But talking to me, I hear from you about these symptoms, so I'm going to bring them out, okay? The folks I chat with will understand this. It's not just you, and I love to hear from you if you can relate to these. Officially now, I have classic Ehlers-Danlos syndrome with autonomic dysfunction, dysautonomia, and CCSVI with one brain lesion and a few MS symptoms. I have had angioplasty. Now, are you ready? Tell me what sounds like you, okay? Prior to a virus, which was my trigger, contracted in 2004, I did remember that I had delayed puberty. Oh yeah, age 16, which is kind of delayed. Poor muscle development and tone, even with extensive exercise. Sleep was always light throughout my whole life. I had a low level of anxiety, which exhibited as overachievement. I didn't think of it as anxiety at the time. Low level tachycardia I noticed in grade 7, which went away with extensive exercise in college. Episode of difficulty breathing for 2 to 3 months in undergraduate school, and I didn't have asthma. No cause was ever found for that, resolved by itself. I did have an episode of fatigue and a low-grade fever for a couple of months while in optometry school, and no cause was found for that either. It also resolved spontaneously. Now, with the virus I got in Costa Rica, can't blame Costa Rica, in 2004, within about 3 weeks of contracting the virus, I realized I had difficulty breathing. I didn't have asthma. I just couldn't get a full breath. I also felt as though I had to remind myself to breathe, like I forget to breathe. Even in my sleep months later, my breathing was shallow and very rapid. My husband counted about 30 respirations per minute as a typical pattern. That's not normal. But when I was breathing, it still often felt as though my brain was suffocating. Sinus tachycardia developed overnight, and although my heart rate was irregular even without a change of position, when I was vertical, my heart rate jumped up dramatically. When I leaned forward in a sitting position, my heart rate immediately increased 30 beats per minute, which is the look the doctors kind of gave me on that one. Tremulousness, oh yeah, I felt as though I was flooded with adrenaline, and even considered the diagnosis of pheochromocytoma and carcinoid cancer, which can present that way. Sleep disturbances, I would awaken, my heart was racing, I was gasping for breath as if somebody just screamed in my ear and scared the living daylights out of me. I had migraine auras, visual auras. I only had one migraine headache, but the auras occurred many times a day. I had episodes of sleep paralysis where I would waken, but I couldn't move. Very scary. TIAs, where transient ischemia attacks, basically blinding you, but leaving a small central island of vision. I had episodes where I never was able to figure out what triggered them, but they would begin as though heat was kind of traveling up my neck to my head, and sometimes I would look flushed. Then I felt as though I was suffocating. Tachycardia, a large jump in my blood pressure, both diastolic and systolic, occurred. Tremulousness was much worse. I was sensitive to any noise, light, movement, commotion, stress of any kind. Even talking was too stressful. The episodes lasted from 20 minutes to about 2 hours, and then I was left shivering and shaking. My heart rate would slow, my blood pressure would drop precipitously. I was extremely weak. Recovery took about 2 days. And initially, the episodes were completely disabling, but between the episodes, my functionality was higher than it is currently. I continued to exercise with weights and went to aerobics, etc., almost every day, as long as I could pick the time. Now, eventually, I could tell an episode was about to occur when my eardrums started to ache. And when I felt as though my brain was suffocating, a tight abdominal binder was often instantly helpful. Although my feet and legs turned purple when I was vertical, I noticed no relief with surgical compression hose. Sudafed and or Zyrtec eased many symptoms initially. Any Valsalva maneuver would exacerbate my symptoms instantly, especially the tremulousness. I had delayed gastric emptying. It was awful. Alternating diarrhea and constipation. I'm sorry, I was going to tell you everything. Okay. Eventually, my head began to hurt, and it started occipitally in the back of my head. It radiated down my neck into like an angel wing pattern. I began to be unable to stay vertical for long without becoming symptomatic and tachycardic. I mean, like 30 seconds. I had constant low-level nausea. Dizziness would come and go. I felt like I was hypoglycemic, but when I checked my blood sugar during those times, it was usually in the high 90s, which should be fine. Nevertheless, eating still seemed to help. I had 2 episodes of extreme vertigo. One episode was accompanied with a noise when I moved my eyes laterally, but not vertically. Both episodes resolved spontaneously, and this is one of those, okay, I'd move my eyes and I would hear ch-ch, 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 always 2 ch-chs, If I went up and down, nothing. Lymph node swelling and discomfort, constantly, pretty much. My uvula in the back of my throat swelled very easily. The very first time, it almost closed up my entire throat, but now it swells for almost no reason. Fasciculations, especially my fingers and thumbs, myoclonic jerks, practically kicked my husband out of the bed a few times. I could hear and feel a buzzing through my body when I was in a quiet room. I noticed it because it would stop for a split second every few seconds. It was not tinnitus. It was much more subtle. It was not a sensation I've ever had before in my lifetime, but it is coming back, and it's kind of like very strange. Numb patches that would come and go. My left hip was numb. My fingers, it felt like I tape on them or something. Some pins and needles in my hands and fingers would come and go. My tongue, especially the tip and front third, felt tingly and almost like pins and needles. I often felt as if there was a baseball in my upper abdomen, and I noticed that on some days my abdomen actually appeared distended. I could often see and feel a strong pulse in my abdomen, especially after I was vertical. I could watch the pulse about an inch above my belly button. I have never had that before. I felt as if something was pulling on my esophagus. My right foot and ankle would shake. I had no smooth movement upon voluntary movement when I tried to stand on my toes, which I think is clonus on my right foot. Brain fog and dementia, oh my heavens. Sometimes I couldn't remember my dog's name, my address, the names of close friends. I was never able to remember why I went from one room to another. I had to give up trying to cook something on the stove because I would forget the stove was on every single time. I couldn't remember a 7-digit phone number long enough to write it down. I would put on deodorant or brush my teeth, and then I couldn't remember if I did it. I missed more appointments than I made, even though I had a calendar. And gaps in time seemed to pass with little or no memory of what happened at the time. It took me 3 hours to get dressed. What's up with that? I was often unable to organize my thoughts or work on anything. I would just sit and look at my desk, unable to figure out how to accomplish anything. I'd read the same magazine 6 times in a row, and each time it seemed brand new.